So I really want to thank the organisers for giving me the opportunity to join you today. I'm going to be talking about an issue that's very close to my heart as both a PrEP educator and as a PrEP user, which is called easy access, what's holding providers and PrEP users back. So, you know, we know that PrEP works. PrEP is being used by millions of us around the world now and has been done for the last 10 years or more. But we also know there are hundreds and thousands of more of us who could be using PrEP who aren't using PrEP. And what is holding us back? What's stopping so many people from using PrEP? Well, I've been spending the last month or so thinking about issues around PrEP equity and access to PrEP equity access. Started talking with colleagues about this framework that I've started to develop that's called SCCOSI. More of my colleagues this morning laughed at me because I've got yet another acronym that I'm working with. But what I tried to do was to try and summarize and encapsulate some of those reasons behind why we might not be using PrEP. And if you look at the slide that's in front of you, you will see 7 or 8 reasons that you'll probably be quite familiar with about why PrEP isn't always used, going right from stigma down to issues around the settings in which PrEP is offered. But you know, today I don't want to focus on those barriers behind PrEP use. I also want to think about the opportunities that we collectively and collaboratively have to increase access to PrEP. So rather than kind of just thinking about what's holding us back, what we can actually do to move us forward. And again, if you look on the right-hand side of this column, it starts to articulate some of the things that we might do within this framework to increase access to PrEP and to increase PrEP equity from both the societal perspective, a provider perspective, and a PrEP user perspective for those of us who ourselves are using PrEP. So let's look at some of the solutions together about what we might do to increase access to PrEP and to increase PrEP equity. So the first issue on our table and in the kind of the framework that we've started to develop is how do we overcome PrEP stigma? What can we do to increase the narratives that help us to understand how we overcome PrEP stigma? One of the things that we've been doing in the UK at PrEPster is an intervention called My PrEP Story. We know that one of the most powerful things we can do to overcome PrEP stigma is for those of us who are using PrEP, when we are able to and when we are in a position of enough privilege to do so, to step forward and to start talking about the reasons behind why we're using PrEP. Here's an illustration here of a friend and colleague of mine called Blaze, who very, very articulately talks about the reasons he started using PrEP. And on our website, we now have dozens and dozens of stories. So this is one way that we can start to think about overcoming one of the barriers to using PrEP, actually come out and start talking about why PrEP is important for us, how it's preventative for us, how it's protective. Very, very powerful thing to do. And then the second issue on our framework, on this COSI framework, is talking about how we can increase knowledge. We know that one of the barriers behind people not using PrEP is that they don't know about it. A piece of work that we did in London a couple of years ago showed that particularly Black African women, the main barrier behind them not using PrEP was they just didn't know what PrEP was and the potential benefits of PrEP. So one of the things that we can do as both providers of PrEP services and people who are using PrEP is really reinvigorate the knowledge base, go out and tell people about what PrEP is, how it works, and the benefits behind using PrEP. But we also know that for many of us, even though that we know about PrEP and maybe we've got to overcome some of that PrEP stigma is that there are also huge access barriers to PrEP, and that might be around affordability. It might be that we know that there's a PrEP clinic 30 kilometres away, but we don't have the transport or the money for transport to go and use it. So what can we collectively do about overcoming some of these access issues? Well, maybe it's about providing PrEP online, or lobbying for generic formulations of PrEP to become available so that those of us who can't afford the patented versions of PrEP within our settings are able to actually be able to use PrEP and have an affordable way of using PrEP. Maybe it's about supporting people in their transport access to a clinical provider, or maybe it's about doing something as simple as offering those, those 3 monthly checks that we normally have when we have PrEP, making them available online or through postal services so that we don't have to go to a PrEP clinical service 3 or 4 times a year. But we also know that there are candidacy issues, and by that I mean that some of us who want to use PrEP are turning up at clinical services and talking about our desire to use PrEP, and yet the clinical services that we are encountering are telling us or are discouraging us from using PrEP. Or it might be that we don't know about PrEP and the clinical service does know about PrEP, but they're actually not thinking that we are a potential candidate for using PrEP. So one of the things we can do is to improve the knowledge base of those clinical services. We can be creating frameworks and risk assessment guidelines that help those clinical services to understand who might most benefit from PrEP, and encouraging those services to start offering PrEP more frequently to some of us who could most benefit from it. And then if we turn the flip side of this over, we know that there are also lots and lots of us who don't understand. We might know about PrEP, but we don't understand that PrEP might be something that we could personally start to use. Here is an example of some work that we've done in England recently to actually name the circumstances when certain groups of women might be ideal candidates for PrEP. And one of the things that we found is that as a sector in the UK, we've kind of skirted around actually naming some of those circumstances. And I think that this is one of the reasons why we haven't seen more women step forward and understand that PrEP might be for them. And in this case, some of the things we've started to do is actually name the fact that if you are a woman and your male partner is having sex with other men, then you may be at enhanced risk of HIV and therefore an ideal candidate for PrEP. It may be that your partner has been injecting drugs and therefore he might be at enhanced risk of exposing you to HIV. It might be that your male partner is from or travels frequently to a part of the world where HIV incidence is much higher. And I think one of the barriers that we can start to overcome around an individual understanding their own candidacy for PrEP is actually naming the circumstances, talking about the circumstances in which an individual or groups of people might be ideal candidates for PrEP. In London right now, we know that the gay and bisexual men who are under 25 are one of the groups who are least likely to be stepping forward and accessing PrEP. And that, we think, one of the reasons behind that is that lots of those guys don't actually understand that PrEP could be for them, or that they might be potentially at risk of HIV. One of the most obvious things that we can do to overcome one of the key barriers to PrEP is to offer PrEP in settings other than the ones we currently are. In the UK at the moment, PrEP is almost primarily available from sexual health services, and yet we know that some of those people who would be ideal candidates for PrEP don't access their sexual health care through sexual health services. They might access their sexual health care from their primary care practitioner, their family doctor, their general practitioner. So there's now a big drive to start looking at the settings in which PrEP is made available. So moving beyond sexual health services and offering PrEP through things like pharmacy services or general practitioners. Here's a great example from Thailand of PrEP being made available through a community-based setting. And if we're to overcome some of these barriers, if we're to facilitate greater access of PrEP globally, then we need to really enhance the numbers of settings in which PrEP becomes available for those of us who most need it. And then what else can we do to start offering people support in both instigating PrEP and ongoing support when we start using PrEP? Here's an example of a piece of work that we're doing right now in the UK to increase the numbers of people who might think about starting PrEP and offering those people support online, by telephone service, by face-to-face outreach work in actually signing up to start PrEP in the first place. And here's another example of a great new intervention of a PrEP app called PrEP Track, which is also offering support about PrEP adherence for people who are using PrEP on a non-daily basis. And as I move towards the end of my presentation, there are two other really key issues that I think we need to be taking into account about overcoming some of the barriers to accessing PrEP. And that's making sure that those of us who are using PrEP are really centrally involved and engaged in research policy and practice around about PrEP and new PrEP technologies. Here's me and my friend and colleague Chris Obermeyer at the International AIDS Conference in Amsterdam a couple of years ago, talking about developing good involvement principles for people using PrEP, GoodiePup. And we've spent the last couple of years working with colleagues at AVAC in developing these GoodiePup principles that we're going to be sharing with colleagues around the world in the next couple of months or so, but actually developing good practice guidance to make sure that those of us who are PrEP users are centrally involved in all of the conversations and discussions. And if we're not involved, then is there any wonder why we're not seeing PrEP uptake in the ways that we might hope to see? And linked to this, another new and exciting network that PrEPster has been involved in setting up with colleagues at Inspira in Mexico is a brand new network, an international network of people using PrEP that is, I guess, the flip side of what we're expecting to do through the guidelines to the good involvement, which is to actually create a network of those of us who are using PrEP to drive forward future conversations about how we can overcome barriers to PrEP use, how we can reduce PrEP stigma, and how we can really start to work with colleagues globally from the research communities, from clinical practitioners, from people who are developing new PrEP technologies to really involve the voices of those of us who are using PrEP to start overcoming some of these barriers. So I'm really looking forward to being able to have the chance to have a discussion in just a few moments' time with colleagues from around the world to talk about how we might start to collaboratively overcome some of these very key barriers that I've just touched upon in my presentation right now, and really look forward to that discussion that's about to follow.